Let's train the platysma muscle. It's a thin, fan-shaped muscle that runs from your jawline down to your neck. So all through here, the jaw, jut, and tilt. Sit or stand tall, jut your lower jaw forward and tilt your head back. You want to hold that for 10 seconds. This directly contracts and lifts that platysma muscle. So it contracts it and lifts it, tightens the jawline. You want to do this 3 times with deep inhalation movement through your nose. Why through your nose? Because breathing through your nose helps your growth hormone. So you get a double hit there. If you liked this video, I have a complete video with more detailed information on my channel. I'm Dr. Rajani and my channel is Rajani MD Skincare. Enjoy.
Now, if you have a double chin or what they call a turkey neck where you have this loose skin, you're going to be very glad you watched this video. They're exercises / stretches that if you do these on a routine basis, you're going to see massive improvement. Here's the problem. As we age, gravity pulls down our tissues and there's certain parts of our body that we develop a lot more loose skin, especially underneath the neck through here. People don't exercise this part of the body at all. You have a couple layers of fascia in your neck. You have one just underneath the skin, and then you also have one on top of your muscle. So there's a superficial and a deep layer. And the cool thing about fascia, which is connective tissue, it has contractile tissue. It's not some extra tissue that is going to be permanently sagging, but you have to activate it. The muscles and fascia through this area are responsible for flexion. Okay. So the head going forward. Okay. As well as the chin coming down, as in when you open your mouth, and also taking the bottom of the mouth and then bringing it downward. That's going to affect this muscle right here. And there's really only 4 exercises you need to do. And so just do these yourself along with the person that's doing these exercises. All right. The first one is going to activate the muscles and fascia that pull the bottom part of your jaw downward. You're going to be opening your mouth just like the person that's actually doing this exercise right now. So go ahead and follow along as you do this 10 times. So you're basically going to drop the lower jaw and open your mouth as much as possible. This is creating tension and tone underneath your chin. Again, it's probably been years since you activated this muscle, and it's a very neglected area of the body. What's going to happen over time as you do these exercises, it's going to start to tighten, the loose skin's going to go away, and you're going to have a nice firmness underneath your chin. Okay, so now let's go to the second exercise. With this exercise, you probably don't want to do it in public. You're going to be basically taking the outer part of your mouth, okay, the corners of your mouth, and bringing it outward and downward, okay? And so this facial expression, this frown, is going to activate slightly different muscles underneath your chin. This is going to activate more of the superficial fascia just underneath the skin. And it's going to focus more on the fascia right here versus lower in your neck. Okay, let's go to the third exercise. Okay, for this one, you're going to tilt your head all the way back, okay? And then you're going to jut your jaw forward or upward as much as you can, okay? And you're going to do that back and forth. Follow along as this is demonstrated in the video. So we're completely extending the neck. Okay, we're stretching all the fascia out. We're also elongating the muscles. Then we're going to take it one step further and activate that last maneuver where we're pushing our jaw forward and getting that last very important stretch. You have to realize that all this fascia is attached not just to your chin, but it wraps over underneath the bottom part of your lip into your face. So that's something very interesting about fascia. It covers a broad base area. And this is why we have to take all the slack out and then create as much motion as we can to create this elongation. Okay, so we're at the last one now. You're going to be lying on your bed with your head extended over the bed. Now, what this is going to do, it's going to activate the flexion or the deeper muscles of the neck. But actually, we're trying to activate the deeper fascia right superficially on top of those muscles. To do that, we have to create a flexion. So we've already done the extension with the head back. Now we're going to activate the muscles going forward. So this is going to work this tissue and really put more blood supply into it and create more contraction and toning of the deeper fascia. So go ahead and follow along as we do this exercise. Now, some people will be very surprised when they do this, how weak their neck is. You just don't work this area of the body very often. So of course, if you don't use it, you lose it, right? So all we're doing is we're putting attention on this missing piece of the puzzle, which is the stretching and the strengthening and the tightening of this fascia. And after you do this for a period of time, please comment down below and share with us the success that you had.
Today, the ultimate all-in-one neck routine. Just 5 minutes every day, and let's do a 2-step routine today. After the face routine video I did, so many of you said, what about the neck? And I hear you, because nothing ruins a great face like a neck that didn't get the memo. This free 5-minute-a-day routine you can do right at home. No tools, no excuses, just 2 powerful steps. But first, let's talk about that neck. It has almost no oil glands here, and that means dryness and crepey skin show up earlier because it's, for one, dry, and of course, oil that your skin produces, it's often protective. Also, the skin is thinner, the collagen is lower, and the support structure minimal. Your face has bone, your neck, it has cartilage, it has your windpipe, but there's no bone like the face has. The neck is a $1 billion industry in the United States alone. Tens of thousands of neck lifts and platysmoplasties are performed yearly. The good news today, your neck only has one real muscle that we need to target. It's the one right here, and it's called the platysma muscle. Your neck might look like this, more crepiness. It might look like this, more a combination of sag and crepiness, or even this one, just a little waddle underneath the jawline. It bothers you, but you don't want surgery. You don't want scars, and you don't want nerve damage that facelifts risk. The anesthesia risk as well. We won't talk about costs because facelifts and neck lifts, they're $35,000 plus, and yeah, you hear ones that cost upwards of $220,000 now. And before you say it, yes, it doesn't matter if you do surgeries, if you've had lasers, if you're doing injectables, or if you never want to take those risks, this method today needs to be a part of your routine. It works with them all. They're not exclusive of one another. Let's dive right into the routine. Your time's valuable. And yes, for a neck cream, in case you're wondering, Neck to Firm is still tops out there. It's by Revision Skincare, and it simply works time and time again. It's worth it. If you're on it, as many of you are, you want to use it after this routine is done. I put a coupon code in the more info section and pinned it to the top of the comments for both Neck to Firm and a gua sha device. Step number 1 is gua sha, and step number 2, you'll use your exercise. I love gua sha for sculpting, lymphatic drainage, and smoothing the horizontal necklines many of you now are calling tech neck, but they existed forever. But no doubt, looking down at your phone has created a whole industry for this, tech neck. But technique matters. Pressure, direction, sequence, and the bone, of course. Let me show you how I do it. When I mention bone in the neck, what I mean is the neck that I'm referring to today will be from the jawline down. So it's your jawbone that's important. So like all gua sha, you're going to start with your Hydroglow or whatever oil you're using, and you want to put it on your neck as a slip. Today we're starting from the jaw down. I actually do the necklet too, as you notice. Why do I wear my shirts down? I can't. If I get a shirt that has that rounded collar up here, I cut it. You'll see that sometimes. I don't like stuff like that up. So I need to, as I say, need to breathe down here. So I include the chest as part of that. I know people wear turtlenecks to hide their neck. That's not going to work for me. I get kind of claustrophobic. So take care of right down through your décolleté if you want. Now, whatever gua sha tool you're using, is fine. Of course, I'm going to use mine today. That's what I'm customized to using. This is a little chargeable tray it comes with. So you plug that in. I travel with this. Sometimes I don't charge it for long periods. It lasts. Hold it in. You'll hear the vibration mode only, vibration and red light. And for those of you where vibration bothers you, we have about less than 10% of our clients, they don't like the feel of vibration. You can turn that off so it's just red and infrared. But I want both because vibration helps with bone, and that's quite well studied. Bone's important. So we're starting at the jawline with this technique today. And this little protrusion here is what I'm going to put underneath the jawline here to work the bone. And we're just working the bottom of that mandible. So we're starting across, working that bone, stopping where? At that gonial angle at the edge. All important. A strong gonial angle, not a masseter, not the muscle, but the bone is key. So we're working along that edge. A lot of people have strong jawlines. They actually have a hollowness that we all, of course, would love to have underneath the jawline, but not everyone gets to have that. But you'll see that right after doing this technique, especially in the morning when you're swollen. So it's about 4 or 5 passes. I tend to use, on the bony areas, the corrugated area on this that you can see here, because that you get multiple points of contact on the bone, actual points of contact where you're getting stimulation. Next, you want to do your lateral strokes. If you have a larger tool like this, it's way quicker, and you want red, near infrared, and vibration. Start in the midline and work across. I'm not worried about the thyroid. The data on red light, particularly 6:30 and 8:30 like this is, over the thyroid looks great, possibly beneficial. So lateral strokes, and again, it's 3 to 5 strokes. Feels really good, and if you have neck pain, sternocleidomastoid pain, you can do up to 10 strokes along there. Often helps with headaches, but for aesthetically, it's just 5 strokes either way. So 5 right, 5 left. Next, we want to go to the upward stroke. So we did our lateral. Now it's upward. The lateral will do your lymphatics, but now it's the upward stroke. And this one really feels good for people, particularly the center line. I talked about in the center, that bothers so many people, and it's tough because that's just loose skin. People are like, just can't I cut that part out? No. Well, let me tell you about a plastic surgeon in France. He had a large neck. He said, oh, just cut me down the middle. And that's exactly what happened. This is a lecturer on the circuit. He had a very large neck, so it was not aesthetically pleasing. His wife said, you got to do something. And he literally has a midline incision. Now, for a guy, it's easier. He can grow a little beard. There's also a lot of hair follicles, so you can cover it up a little bit. But he just went for an open approach. For most people, you're going to have to cut around the ear, hide the scars back behind the hairline here, and come this way to get rid of just that little waddle. So the more we can do non-invasively, minimally invasively, prevention, way better than the surgery that leaves scars and has risks of what? Nerve damage. It's real. So you want to definitely slow, again, 5, 10 max each side. Again, you got the red, near infrared, and the vibration. Okay? And I'm just doing a shortened version here so you don't have to watch me do it. This is something I'll do every morning. It feels good, it looks good, and of course the neck is puffy when you wake up, especially depending on what you ate the night before. So you now have that. The bone, you have the lateral stroke, and then the upward stroke. And you can, focus on areas a little bit longer that bother you more. For many, it's honestly the center line that bothers them. But if you have a blunted angle here, so not a sharp angle, you can spend a couple more strokes laterally. Just don't forget about the bone, because that's what is the structure holding everything up. If you have the crepey skin down lower and you want to avoid the thyroid, you just move the skin to the side. So in this case, if you wanted to treat centrally, but you're like, oh, it's over the thyroid, personally, it doesn't bother me one bit. Look at the studies, get comfortable with it. But if you wanted to, you can move the skin laterally and then treat it. And that way you avoid it. That's what we do. The more loose skin you have, the easier it is to move over to treat away from the thyroid. That's what we do when we're doing RF in the clinic or certain lasers. Move the skin to the side, treat it off of the thyroid, and then allow it to spring back. Okay, here's your step 2 that everyone misses. Let's train the platysma muscle. It's a thin, fan-shaped muscle that runs from your jawline down to your neck. So all through here, as you can see in this anatomical picture. And we're doing 3 of them today. No weights, no gym. Number 1, the jaw, jut, and tilt. Sit or stand tall. Jut your lower jaw forward and tilt your head back. You want to hold that for 10 seconds. This directly contracts and lifts that platysma muscle. So it contracts it and lifts it, tightens the jawline. You want to do this 3 times with deep inhalation movement through your nose. Why through your nose? Because breathing through your nose helps your growth hormone. So you get a double hit there. Number 2, we have the L-shaped stretch. Turn your head at a 45-degree angle. Look up and gently stretch the skin of your neck. You'll feel it pull under the jaw and through the platysma. You hold that for 10 seconds each side. That's going to target your diagonal fibers for more contour definition. The platysma has different fibers, and these are your diagonal ones. And the third is the tongue to roof smile. Many of you are already doing this. It works the floor of your mouth. So press the tongue to the roof of your mouth hard. At the same time, you're going to smile, but your lips need to be closed. You'll feel the neck tighten from inside. You want to hold this for 5 seconds. Repeat that 5 times. That's going to engage the platysma and the deeper suprahyoid muscles that lift the lower face. So they lift the lower part of the face. Now this neck protocol is what I recommend for my patients, whether they've had a facelift or, most importantly, they want to maintain or they're just starting to work on their skin tone and firmness from home. Most people don't want to go into a clinic. Now what spurred this video on? It was this one on face exercises for your complete face routine. Watch it here. Keep your skin and body beautiful, healthy, and vibrant.
How can you tell that you might develop jowls? In just a few weeks, you will see amazing results. One of the biggest problems that can add 10 years to your age is having jowls. This is a deformation of the subcutaneous tissue, as a result of which the contour of the oval of the face floats and the face immediately becomes older. But there are a few magical techniques that can solve this problem in just a few weeks. And that's what I'm going to talk about today. First, I want to explain why jowls occur in the first place. There are several factors that contribute to their appearance. The first is the biomechanical factor in our body. All organs and tissues are interconnected. And when deformation appears here, it is associated with stress. Not only in the face, but also in the neck, in the chest, and even in the stomach. The second point is just fluid, swelling. Chronic swelling on the face leads to the fact that the soft tissues of the face begin to deform prematurely. Because the fluid, under the influence of gravity, constantly presses down and stretches the skin and soft tissues, the inner face. The third point is psychosomatics. Our face expresses all possible emotional patterns, and there are many facial muscles on the face. And you can even see in this picture how emotions, tension in the lower third of the face around the lower jaw, and chronic tension in the facial muscles. Ultimately, this will also lead to tissue deformation, swelling, and the appearance of jowls. Now I'm going to show you how to get rid of jowls. But in reality, you can get rid of any problems on your face. You just need to know the techniques and perform them correctly for a few weeks. Why does deformation occur? If you look at this picture, it shows the different layers: skin, subcutaneous tissue, muscles, bones. When tension arises in the muscles and bones, you can see here, highlighted in green, are the lymphatic vessels. Muscle tension creates swelling in the area of the fat tissue, the subcutaneous tissue. Stagnant fluid starts to deform the skin. As a result, jowls appear. Jowls have a distinctive feature because the face is divided into certain fat compartments or packets. Fat compartments between which there is a ligament. And here is the characteristic area where jowls appear. This is a fat pack where the muscles are located. And if there is constant tension in this area and fluid gets stagnant, deformation occurs. And that's how these hanging jowls appear. Here in this area. What other muscles affect this? If you look at this picture right here, you can see it clearly. So chronic tension in these muscles, specifically the platysma, is highlighted in green. This is the platysma muscle, the one under the skin. This is the muscle that lowers the corner of the mouth. These two muscles in chronic tension, they cause deformation. Why do they tense up? They express emotions, sadness, sorrow, and gloom. And these go down to the subconscious level, means that these tensions go deep into our body, that is, into the deep inner layers. And even later, when a person relaxes, he still displays the facial expression of a dissatisfied person, and these jowls appear. This is why psychosomatics can already lead to premature aging of the face at the age of 30-40. And now I'll show you a simple diagnosis to understand if you might develop jowls. It's very simple. When jowls start to appear, there is noticeable tension in the front part of the neck, and right here in the area of the lower jaw. If you throw your head back and feel that you have a tension here, this tension indicates that you already have what looks like overstrained muscles and fascia, which in fact will lead to facial deformation. The second point is that such heaviness can appear on the neck. For those people, especially women who have pronounced heaviness, it indicates that they are overstrained. Often, jowls are connected with heaviness in the neck. The next point is chronic swelling. If you feel that fluid is constantly accumulating here and your face becomes puffy, especially your cheeks, then you understand that it's just a matter of time. It accelerates the aging processes of the tissues many times over. I recommend that you put on a glove or wash your hands. Next, we will be doing an intraoral technique. So our task will be to grab the corner of the mouth where it actually attaches. This is the muscle. Do you see? Our task will be to massage this area. Massage, and you can also vibrate. This helps a lot. So you take your finger, place it in the oral cavity, grab the corner of the mouth, and start making circular movements. At the same time, the other hand can hold the lower jaw. After you've done the circular movements and the vibrations, you finish with kneading massage movements. In order for the tissues to relax, they need to be kneaded so that the stagnant liquid comes out of there. The fluid comes out best when the tissue is already relaxed. Then you make a massaging movement. As you do, that is, you grab the cheek from both sides, up to this area of the corner of the mouth, and begin to rub the jowl area between your fingers. And so you do it for a few minutes on each side. For a few weeks, you will see amazing results. You just need to do these techniques every day. In fact, kneading only the cheeks is not enough. I mentioned there's also the subcutaneous muscle of the neck. You can see on the screen that when it tenses up, it creates these bands, and this also contributes to the line of the jowl. You can work with it easily since it attaches to the rib cage. You can place your fingers right here on the area, under the collarbone, and start making gentle circular movements. Don't pull too hard, just release the tension and make circular movements. You'll feel how this muscle stretches just in this position. Gently pull it a bit. You can also rub it to help those fiber bands relax, and then they will release. So you can do it on one side, then the other. Well, of course, even that might not be enough because, as I said, the jowls can develop starting from the pelvis. Because imagine all the muscles, fascia, organs, they are all untied. So when I pull even a shirt, there's tension. So even if there's a scar deep in the pelvic area, like after a C-section or from... I talk about how to work with all the issues in the body on my channel. So make sure to like and subscribe. See you next time.